We don't define ourselves necessarily as advocates. We are advocates, most definitely, but we're also navigators to a certain degree. It's very clear in all of our contracts that we are not providing patient care. We are only providing information and resources. And we firmly believe that by providing information and resources and allowing the patients to make informed decisions, we're affecting the outcome of their care.
I think that you really have to listen to what your doctor tells you. I think when you are going in, and before you're going in, I would suggest making a list of questions, making sure that you understand everything, listening, and then asking questions of the doctor, I think is a really important thing to do. And also, if you think something is wrong, if you can't advocate for yourself, and we don't know these things sometimes when you go into a situation, but it's good to have someone with you who also has taken notes and heard and has your list of stuff in front of them.
It can be a family member, an advocate can be, a caregiver, but somebody has to be able, even in doctor's appointments, if you're not feeling well, taking notes, listening.
The idea is that you would think through what your wishes are should you lose the ability to express those wishes. So you would think through, do I want a ventilator? Do I want a feeding tube? Do I want aggressive treatment? Do I want CPR? All of these range of things that medicine can do, you would pause and think, is this something I want my body subjected to?
Advanced directives can change over time, as can pulse forms. And pulse forms are generally indicated when you have a year or less to live, because they're very specific about CPR, shocks, breathing tubes, and feeding tubes. And like right now, you're going to say, of course I want all of those things. And there may or may not be a point to filling it out at this point, but if you're diagnosed with a serious illness, that's the time when they're very appropriate. Advanced directive, your 18-year-old can fill it out, but in 5 years in a different circumstance, it may change, and you can always change it. And that always helps my patients. Like, this isn't written in stone. You can change your mind.
It's also, and actually even more important, to have the conversation with family, because the document may not address the exact situation you're in. So having family members there who you've had conversation with, who can say, well, we talked about this and this is what my loved one told me, that's really important. When you're thinking about who to appoint to be your spokesperson, don't necessarily choose the person you like the best or you love the most. You should ask yourself, who do I know will really stand up and be my advocate? And that might be the same person, but it might be someone else.
When I'm in the room with an oncologist, with a 90-year-old man, like I was yesterday, 2 days ago, talking about getting a biopsy, talking about the kind of treatment he might be able to have for his cancer, I turn to the oncologist and say, what's it going to do for him? How much time will it give him? How will he feel going through this?
So a mentally competent, terminally ill patient, and they might be dying of any of a number of things. Cancer, ALS, a whole host of things might be causing their death. They can raise with their doctor the question of, would the doctor write a prescription for medication that the patient could ingest to achieve a peaceful death? For the states that have had an open practice of aid in dying, we have a lot of data about who chooses this and why. And one of the interesting factoids is that about a third of the patients who get the medication don't take it. They get it, they put it in the medicine cabinet, they're hugely comforted to have it, and then they die of their cancer. And so if you think in advance and you make your plan that, well, I know I want to die at home. I know I want to die without a lot of pain. You can make decisions that will make that more likely to happen.
What we give loved ones and caregivers and family members is peace of mind that they've done everything humanly possible for the care of that person, and that you can't put a price tag on that.
I had a nurse try to give me the incorrect medication. I paid very close attention, obviously, to my doctors and knew that I wasn't supposed to have certain medication until the next day. Kept giving me the wrong food, and I wasn't supposed to have certain things. And I just felt very alone. What if you don't speak English? What if you don't have anyone here? What if you maybe didn't listen, or you didn't take notes, or you didn't pay as close attention?
I think when you're the patient, you see physicians as your saviors. And when you're on the other side, when you're on the advocating side, you see them as human. And you're less intimidated to ask questions of humans than you are of physicians, because we are a culture that has been raised to revere doctors as saviors. And it's the practice of medicine, and we have to remember that.